Next researcher we're going to hear from is Elizabeth Salmon from the University of Kentucky. She's going to talk to us about brain-machine interfaces. And you just have a single slide, is that right? Okay.
So my name is Elizabeth Salmon. I do my research at the Center for Biomedical Engineering at the University of Kentucky. And my project is the development of an EEG brain-machine interface to help with spinal cord injury. So the goal of our project is to help improve hand grasp function in spinal cord injured subjects by using their intent to move to trigger sensory feedback. So spinal cord injury can cause disability, like very widely ranging levels of disability, and we're concerned with those who have some hand function, but it's definitely impaired. So one model of spinal cord injury rehabilitation involves 2 hours of peripheral nerve stimulation, or PNS, followed by intensive physiotherapy. PNS is a low-intensity electrical stimulation. It's painless. The theory behind that is that because it is a low intensity, the signal travels up the nerve to the brain and it excites the sensory cortex of the brain. And this increased excitability increases the effectiveness of the physiotherapy, which is performed after the stimulation. And the physiotherapy usually involves highly repetitive exercises to strengthen the remaining connections between the limb and the brain. PNS and cortical stimulation can also increase the adaptability of the brain. This uses a loop of motor and sensory input. So the cortex is stimulated, it travels down the spinal cord and acts on the limb, and the peripheral nerve stimulation travels up to the brain. And having both the motor and sensory input is extremely important to proper motor function. Just 2 simple examples to give you an idea of the importance. Trying to walk if your leg has fallen asleep, or if your mouth is numb and then trying to talk. Both of those are very difficult things to do. So we decided that we want to combine the peripheral nerve stimulation and the motor intent, which would be the cortical stimulation, as a type of therapy before an individual would perform their rehab exercises. So to detect a subject's intent to move, we will use an EEG brain-machine interface. So there are changes that are detectable on EEG over the motor cortex when an individual is planning or attempting a movement. And this figure down here shows we presented the subject with a cue at time 0, and then there is a decrease in the signal after a small delay, which lasts for about 1 second. So in our experimental setup, we record EEG, EMG, and hand grasp. And we present the subject with a cue, which is an indication for them to attempt movement. And we monitor their EEG, and if we detect the change in the signal, we will deliver the stimulus. So we have the cortical activation paired with the peripheral stimulation. And so far from our data, we've seen that this should be possible to carry out. And our next step will be to carry out a small clinical study with our collaborator, Dr. Lumi Sawaki, with UK's Department of Physical Medicine and Rehabilitation. And we're hoping that we can help spinal cord injured subjects have greater improvement in their function and quality of life. Thank you.